Hi, good afternoon. I'm so happy to be here. I'm from Malaysia. My name is Kenny Young. I'm the doctor that is in the Wellgain Healthcare Center. And last year we were here also. We are so happy to be able to come back again. And we have been using hyperthermia for cancer vision for 4 years ago. I think it's around October, just slightly after the lockdown. October 2021, yes, around September, October, that time. And it was very useful for us because we try to also use this machine for antiviral effects. And it can kill a lot of virus, bacterial, fungus, parasite, and mold. And it is wonderful. So I'm here to give you a talk about our experience being the very positive one, and the hyperthermia in using the technique to induce a complete remissions, and then using the hyperthermia to induce these cancer vaccinations effects. That means converting the tumor as an enemy into a friend, and using the tumor material as an immune stimulations. And there's no tumor in this world that you cannot convert them into a vaccination material, because cancer is something that is non-self, that is foreign, and this is an antigen that is friendly. Actually, if it's in your body, that if you can convert it and use it to educate your white blood cell or your immunity to cure the cancer inside out. And complete remission, this word, is actually a host response. It is a response of the human body towards clearing the disease itself, the challenges. So it is not so much about looking at the person as a sick person, but actually looking at the human with the disease as a hope to have a complete healing. So we can go through the patient's information. Maybe we start with the case, and this is one of our patients. We have many patients that we have helped them with integrative approach to cancers. This is one out of the most recent case, and this is one lady, 50 years old lady with a long history of tumor. You can see right breast carcinoma. When she returned to us, she was having multiple metastases in the lung, the liver, the bone, the brain even. So this is like they call it the useless case. They call it the GHAD case, you know. GHAD is go home and die kind of case, you know. So you can see from May 21st, 2017 May, the mastectomy was done on the left breast, and then chemotherapy was given, and then hormonotherapy, the standard textbook or the standard treatment. And then of course there is some response, yes, and then less than a year, in March, there is also started treatment with the oral chemo. And then on the 2025, that is also completed chemo. And then there's a relapse when just recently came back to us. And you can see that this is the brain MRI that is done on April 14th. Okay, and there is also involvement. The metastasis actually is in the brain area as well. So there's multiple metastasis also at the skull area. So this is really a very advanced and end-stage case. And then you can see that even near to the orbital area and frontal area, there is tumor. And we can compare the PET scan from last year, September, and this year, April, that you can see September last year and this year, April. You'll be able to see that is progression of disease. And then the PET scan was done April, that you can see the left lung. There's a nodule liver lobe, okay, and then there is the hepatomegaly. The liver is swollen, okay, and then the left lung, there's pleural space with water, and then we actually put in the chest tube also to drain the water, and then we put in the mistletoe as well. We started the integrative treatment for this patient, and even though this is a hopeless case, okay, we still offer the hyperthermia as a adjunct or also add-on or to relieve and rehabilitate the patient is wonderful. This is day one on the May 5th that you can see this, both legs is so swollen, and also a lot of complications from the intensive chemical treatment in the hospital, the many side effects. And 15 days on the day 10. This is on the day 10 after 20 hours of remissions. Okay, apply to the tummy area. The systemic mode 2 hours, and we also try to follow the intensive schedule of 2 hours twice a day. That really make the difference. And you can see that this is the no smile before and good smile after. Okay, this is like 2 weeks. Okay, 30 days. So we have designed and also recommended the treatment, and it is within 30 days. Okay, so you can see 56 hours of the hyperthermia. 12 hours, 6 days, and per week, systemic 2 hours. So we try to do as 2 hours in the morning, space out by 6 hours, and then try to do another sessions in the evening within a day if the patients can be follow up and also coming through. And we also teach the patient to do the modified Gerson treatment, which is with the coffee enema. Twice a day, and then we also teach them how to do the ozone at home, and also help to do the ozone and oxygenation therapy. Of course, we teach them how to do the liquid diet, and also human milk. Human milk is also given to end-stage cancer patients, which is very normal. And in Malaysia, there are many moms with the breast milk that they want to donate and give. We also prescribe this and for the patients to take. It's wonderful. I think it's very fair for us to have breast milk while we are at the end stage of life. This is the most nutritious food on earth. And FMT is actually the full microbiome transplant. So this is wonderful. And then we help the patients to go through the microbiome restorations. And AIET is actually NK cell. Somebody was asking whether NK cell can be combined with the hyperthermia treatment. It is absolutely useful. Cellular therapy is wonderful. And then it was done on the May 29, I think it's just recently, right? Yeah. So it's quite a recent case, and we're still following up on this case. This is one of the cases that is quite astonishing, that is quite a surprise to us as well. And 30 days progesterone blocker for this patient, we started this is like a placenta blocker, a placenta chopper, It's like every tumor has a placenta unit that supplies them and protects them. So if we put them on the progesterone blocker, we can actually chop off the placenta supply, the protection, like a force field of the tumor, that you can actually achieve wonderful result, even at a very advanced stage. This is a simple chest X-ray from April 18 and May 6 and then May 14 and then June 3rd. You can see that initially chest tube is there, water rising, and then now it's completely dry up. It's very nice. And I think the patient no longer that short of breath anymore. And although there is still tumor inside the lung that we are still trying to help the patients to overcome, I think we need to really understand that tumor progressions is because of the immunity going down, one of the very important factors, and also not just the tumor is growing, but then because the tumor is growing unchecked by the immunity, that we can stimulate the immunity of the patients and then allow the immunity to kill off or clear off the tumor. So in order to achieve the tumor regressions, so that the tumor progression is reduced, we want to increase the tumor, we want to reduce the tumor progression. We want to increase the tumor regressions, right? So these are all immunologically linked to the human host. I want to encourage everyone not to give up, even the patients given up, or maybe the hospital given up on the patients. But we need to offer much more option for patients so that they are able to also heal themselves inside out. And sometimes the human body, created by God, it can create a lot of miracles that can surprise us if we continue to believe it. So, okay, so why is it so hard to cure the cancer? Most likely, one of the very important factor is we are limiting ourselves too much. And we are living in a box. We box ourselves in. And then the patient can only choose to go home, go to hospital, and then go to hospice. Between the hospital and then the hospice, there is no other options available. So as a doctor, I think we have to offer a lot more than just the fixed schedule, by the insurance, by the government, by the doctors or the hospital, by the drug company and this and that, and drug as an option. I mean, there's so many things outside this non-toxic, non-drug items, So that's what integrative oncology is all about. And, we hope we are the doctor actually focusing on the human with some disease rather than, treating, we've forgotten about human. So, patient is first a human and then a disease, So, sometimes doctors is like a pharmacist, actually, just, giving all the medicine, and then there's nothing else. So I don't think we should make the patient palliative first in order to give them more options. I think we should prevent going into palliation is the most important steps that we should be taking and be bold about it. So if we ask the white blood cell, why would a human get cancer? Then the white blood cell would tell you, actually your body is not able to reject the foreign body. And number two is that the white blood cell say, my T cells is exhausted and I have corruptions. And then number three is the white blood cells say, oh, I cannot have fever. My body is always cold and I cannot because my I'm not sensitive anymore. The white blood cell would say that, I'm active. Sometimes the white blood cell say, I'm active. I have a lot of white blood cell, but I cannot see where is the cancer. Sometimes the cancer is hiding. Sometimes the cancer is wrapped up, folded and hiding. So that's very important because every tumor we can see in the scan, most likely 10 to 20% is actually the bad guys. But then it is wrapped up by good guys. That is what, probably 80% that is a good cells there. Okay, so the science is actually how can we induce this relapse-free complete remission. Now, complete remission, anybody has any idea about complete remissions? So complete remissions is like you see 50 to 100 to 200 tumors in the PET scan. Then after 2, 3, 4 weeks, right? Wow, the tumor is gone and then it's clear. So that's what we call the complete remissions. Now, it is possible to induce that because complete remission is a host response. It's a body response. It's an immune response. It is an immunological realm changes. It is not just a tumor response. It is actually a host and human and immunity response. So we have to go and think about the immunity and how to help the human survive the body. It is important. So therefore, maybe we should change the other way around. Conventional cancer patients will have the surgery remover, radiation, then chemo, and then get repeated. Then later will be immunotherapy. Then, okay, we can try some cells therapy, which hyperthermia can help in immunologically improve our white blood cells, and also hyperthermia can raise the NK cell endogenously. You can produce more NK cell. So how about we turn it around that we should start with cellular therapy, thinking that is I'm so happy to see NK cell is there as an option in integration oncology, and then immunotherapy like ipilimumab, the ipilimumab, linvolumab, pembrolizumab, Keytruda. These are all the options available for the patients. Not just high dose, but we can even do low dose or medium dose. That's okay. So most likely we can do NK and then immunotherapy, then radiation, then chemo, then surgery. Maybe we do low dose radiation. We don't even need chemo because the regression is there. And then tumor progression is reduced, and then the tumor regressions happen. And then with the momentum, maybe surgery, we just need to do a minor one. Okay, so this is the other way of thinking. Now, complete remission, is it possible or not? Yes. If you go online and search what is complete remissions or spontaneous remissions, you will find out in the history of human mankind, there are many tumors that can disappear suddenly. The cancer patient lost all the hope, but then suddenly the tumor disappeared. Every tumor in the body disappeared. Now, this is what we call spontaneous remission. It is usually associated with fever. Whole body fever, localized fever, or certain infections happen. The person go through very high fever. Even during the COVID-19 era, when someone is going through the COVID-19 and have fever, and then all of a sudden the whole body get well. All right, so fever is very well known to induce complete remissions. So I want you to challenge yourself to check it out. How do we induce spontaneous remission? It's important. So this is a very beautiful lady, 10 years now is I think 10 years cancer free. This is patient number 1, Emily Whitehead. So is it possible to have a complete remission? This is Emily Whitehead. This is the so-called world famous patient's number 1. This is the first ever patient received CAR T cell in the world, and then she got cancer free for many years, and now she's still healthy. And online you can search about her, and she belongs to this group called the CRI, Cancer Research Institute. So if you go to YouTube, you search CRI, there are many education about complete remission inductions. And so what did she do? Actually, this is a very significant treatment. She did the CAR T cell treatment, which is, the principle is like take the cells from your body, extraction, we reprogram the white blood cell from you, and then we multiplied it and grow, and then before I put it into your body again, I will have to go through a last round of the ablations, which is the chemical ablation called the chemo, the last round of chemo to kill off your corrupted T cell and B cell. So T cell and B cell corruption is a real issue in all types of cancer patients. We have to understand that cancer patients cannot clear the body of their own tumors, which is hiding, yes, I know, but then, the immune system somehow is corrupted or so-called screw up, okay? So we need to really unleash and release and also stimulate the immune system. Rather than suppressing it, we need to enhance it and create more momentum for healing inside out. And how do you do that? Is actually to understand also their own immune system is corrupted or somehow decided not to kill. So the CAR T cell is actually, and then it works really wonderful for Emily Whitehead. But then she has to go through 2 to 3 weeks of very severe fever in the hospital. So, but then fever is useful for cancer patients, very unique. So we have to think cancer immunotherapy, the whole idea is to make sure that we can survive the patient. So you can see conventional therapy is as good as no therapy because we need to, as long as the treatment is involving the immune system, all of a sudden the patient have higher chances. And then if we combine multiple treatment protocols together through the immunotherapeutic way of thinking, then the patient survival rate is much higher and patients still alive, you see. So this is important concept that we must know. For example, I use this product called MYJ1633. This is actually an NK cell that you can take from the blood and then they will grow it to 1 billion, 2 billion, usually 2 to 3 billion cells that you can, it's pure NK, that you can give it back to the patients, and it's also dependent on the patient's nutrition. So it is kind of good for us to focus on food, nutrition, supplementation, liquid diet, juices, blender, juicer, and then this supplementation, immune stimulation, thymosin alpha-1, all these immune stimulant to stimulate the immunity so that we can let the patient go through 1 or 2 weeks of stimulation and then take the blood and then send to the lab, and then we can, make a good NK cell for them. Now, for example, chickenpox in childhood chickenpox. How many of you have chickenpox, right? When we get a chickenpox, we get lifelong healing. Why is that so? Because our immune system is very specific, okay? And our immune system has memory, okay? Our immune system is very strong, 100% it will work, and then as long as they can see the bad guys, okay? And then they can blacklist any kind of infection or foreign body inside our body. All right, and then this adaptive immunity is called a crosstalk. So the whole idea is the T cell need to come out and then clear off the tumor, and then to cross the B cells. That's important. So this primary immune response dynamic, we need to go through the innate response. The T cell will come out, and then the antigen crosstalk. Usually it takes about 20 weeks, 10 weeks for our immune system to work because there's a delay sometimes. Okay, so it's important. So in cancers, there's a good God that created human, and then He loved us, He created us, but He gave us this immunity. So what is good immunity? We need badly needed immunologists to think like an immunologist. What is immunology? Is antigen antibody memory. So we can overcome cancer like a flu. You will never get the same flu twice. So we can use our immune system to reject the cancer once and for all. and then we can induce the whole body tumor abortions. That's what we call the remissions, complete remissions. A grand simple goal is lifelong cancer rejection immunity, creating an immunity that can reject the cancer that long-lasting a lifetime. So that should be the goal that every one of us should challenge ourselves, how we can actually proceed and also help our patients. So this slide talk about teaching the adaptive immune system to recognize an antigen. So process the antigen and stimulate the T cell, B cell to let them fight, okay? Let them fight and have some fever, and that's what we call the cancer vaccination effects, okay? So 5 steps to do this. It's simple. First of all, you ask yourself, where's the cancer? There's a liquid phase and a solid phase, right? The solid phase is a PET scan, ultrasound, chest x-ray. You will be able to see the location of the tumor, and then there will be a liquid tumor. The liquid tumor is to take the blood, send to the lab in Greece, you can check the cancer stem cell. Then find out the liquid and solid origin, okay? And then make this occult hidden antigen obvious. So find out the antigen and then process it and make it obvious, rather than just hide away and scare them away, or you're afraid about seeing the cancers. Don't worry about it. Just look for the cancers and then heat them up, Where's the host immunity? Identify the bone marrow functions and then stimulate them, okay? Unleash them. And then let them fight. Don't be afraid of letting the patient to go through fever, because spontaneous fever is actually healing. As a matter of fact, the only way for a cancer patient to heal is to see them having fever themselves, by themselves. Okay, that's very important. And then the crosstalk. Crosstalk means whole body fever. Okay, without even the machine, the patient is able to have fever even without your machine's help. Okay, that is the ultimate goal that we are trying to create. So all we want is the patient's own ability to reject the cancers and blacklist the cancer for the rest of their life. Okay, so that's important. That's the phases of adaptive immune response. That is this expansion, differentiation, apoptosis, and retention. So we want to create a memory. So, and we want to create the abscopal effect, for example, 10 tumors, we manipulate a few tumors, improve the immune system, the body will reject the rest of the tumor. So that's the goal, and then abscopal effect is common and it's not rare, okay? Local regional manipulation of tumors to elicit a systemic full body immune responses. And then to achieve tumor regression by the host, okay, not by the other factors. And these are the 5-fold principle to induce that. So cancer patient has the low immunity and then corruption, lack of fever, and then cancer is hiding, and then the bone marrow is destroyed or thymus is weak. So we reverse these 5 things by immune stimulations, anti-corruption drips, okay, and then induce the fever. In our center, we help patients by heckle, hyperthermia, whole body, and then remissions are very intensive, 5 times a week, twice a day, and then Coley's vaccine, we use that for intratumoral injection. And then we actually induce the fever. And then we also refer the patients, work together with a radiation oncologist for tumor planning, radiation low dose to the tumor area and converting the tumor into a vaccine. And then we order some tumor vaccines from Greece as well for the patient. And then we also put in the cellular therapy if the patient can afford, and also look for it. And yes, we make it available so that the patient is able to increase the APC, the antigen presenting cells, okay? So this is a 5-fold. Now, when we have a tumor, you want to cut it or you want to heat it up. You have a choice of heating up the tumor first, okay? And then when you heat up the tumor, the PAMs and DAMs will come out. I think Dr. Kang, wonderful lecture this morning talking about pathogen-associated molecular patterns. And then the damage-associated molecular patterns is wonderful. These are the factors that you can induce and leak it out. And then you recruit the whole body to reject this cancer inside out. And then you will have a complete abortion of the tumor, tumbling, the whole body reject the tumor and abort the tumor out of the system. So local regional manipulation of tumor will lead to a systemic whole body response to reject the tumor. So it's local and then became a systemic effect. This is important. So low dose radiation is really helpful. So I want to encourage every one of us that is able to open ourselves up to work with the radiation oncologists around the world. So our goal is to train 5,000 doctors to do this, in integrative oncology in Southeast Asia, to be able to, network together with the specialists and then the hospital together so that we can have a multi-modality hospital that is able to provide hyperthermia to also combine with the radiations. Because radiation has a rationale for fractionation is because the 5R. The 5R is repairing the tumor and the human there, redistribute the immune cells back into the tumor, and then reoxygenate the tumor so that it became thermosensitive, and then improve the radio sensitivity, and then we want to repopulate more immune cells into the tumor. That's going to happen when you do low dose radiations. So it is important. So spontaneous remission, this is what I mean. If you check history, like 62 years ago, this Dr. William Bradley Coley actually discovered infection can cure cancer. Okay, and then you can see incomplete surgery usually will lead to infection, and then the infection will give you fever. After fever, there is 300 over spontaneous remission ever discovered in the world. But then now you ask a lot of doctors in the hospital because of antibiotic, this and that, and then fever is not allowed anymore in the hospital. I think this is a very bad news if fever is not allowed in hospital. I think we should have different kind of hospital that welcomes fever and take the risk of having fever, control fever, 1 to 3 hours, local, regionally fever. That is a very important factor, okay? So this is Dr. William Bradley Coley. I think this is the girl that I'll show you, this Emily Whitehead. And this is Coley vaccine that we use. And then we hope to see the world is using Coley's vaccine injection. And also we want to, network with you if you use these products. Okay, so Coley's vaccine is helpful, especially for failed cases. And then you can still try an intratumoral injection to convert the tumor into an infection. It's like a fake infection. So basically when the tumor is dirty, when the tumor is infected, the white blood cell will say, this is the place I need to come in and clear myself. And that's how you make the cold tumor become hot. That is a very important. That's hot spot management. Converting a cold tumor into a hot spot that the immune system is able to see that. Okay. This is the PEMS and DEMS. This is actually by CRI talking about how we can kill the tumor and release the antigen, go to the lymph node, recruit the system, and then coming back to attack new tumor. So this is wonderful is because we use the resistive type. That this is a smart selection of tumor cells that is under the frequency. To me, 0.46 is a frequency from God that I think that this frequency is very special frequency that is able to kill virus, bacteria, fungus, parasite more. I guess one of the main reason also is because a lot of viruses and bacteria and fungus inside the tumor is being killed as well. So there's hyperthermia that is able to heat the tumor right inside out. The probe shows the temperature of the human, but then even inside the tumor is hotter than the monitoring system. And then it is proven to improve NK cell endogenously for 500 times. So this is a clinical result. It's wonderful, and we are very happy that with these different probes and the resistive type heating inside out rather than outside in. And this is the diagram that is very famous, that it is talking about hyperthermia able to destroy the tumor, release the antigen, okay, inhibit the repair of the cancer enemy, okay, and then heat can cause direct cell death, and heat can release the heat shock protein. And the heat in the tumor can activate the dendritic cell, the T cells, and sometimes after the hyperthermia, you will have some good response. Good body healing response, okay? Don't be afraid about that. The tumor is making me worse. Hyperthermia making me... No, these are the responses of the human body towards healing. And it's very important, I think. So causes cell death and inhibits the DNA repair of the cancers, okay? And lymphocyte trafficking, it will help lymphocyte to come back to new tumor area. It improves the blood flow to the cold area, okay? I think my time is up almost. This is the whole body hyperthermia. I think some of you practice this as well. I think Taufik is here as well. And then there are many practitioners whole body. That is also good. This is for the cold spot metastasis, small little tumor everywhere, in the brain, this, that. In conclusion, abscopal effect is inducible. We need to conserve, preserve the immune system, protect them, stimulate and revive, okay? do the PD-1, PD-L1 drip, let the patient go to do it, or you do it for them. Low dose, it's okay, go to hospital to do that, combine it, okay, induce a fever, okay, using different methods. And then combine with the low dose radiation. Don't be afraid to inject the tumor. Just now I saw Cha Hospital doing intratumoral injection with mistletoe. It's wonderful. Very famous treatment in the Germany area is intratumoral injection. Wonderful. And then use the biologics from RGCC, personalized vaccine, rebuild the bone marrow, replenish the NK cells. Okay. Don't forget to manage the host. Okay. The host is very important. Don't kill the host, okay? The best way to kill the cancer, not to kill the host, but I have a 3 take-home message, is that hyperthermia must be offered to all kinds of cancer patients, even there is no more option. Okay, this is message number 1. You need to offer hyperthermia to the cancer patient, even there's no hope. Okay. Number 2 is that there's so far no human cancer that's resistant to heat. Okay, all kinds of cancer can be conquered, can be tamed down by heat shock protein. Okay, they are heat responsive. Okay, number 3 is that all the advanced centers will call themselves advanced. Okay, you cannot call yourself advanced if you don't offer hyperthermia services. Okay, though this is the take-home message. So when the cancer and the host didn't die and change the drug, no, we have to change our thinking. Sometimes if the tumor regression doesn't happen, so what happened? We change the strategy. Okay, not change the drug or change the method have to change. Okay, and then the patient, don't forget the patient is a human, 95% healthy body, then 5% is tumor. Don't miss out the forest because of one single tree. Okay, so manage the host. How do you make the human survive? Okay, full body detoxification, restore the microbiome. Okay, give them full spectrum nutrition. Formulate a team for oxygenation. I can see intra-ocean out there with the oxygen therapy, hyperbaric HBOT, immunomodulation with the thymosin, immunocotel, right? Yeah. And then non-toxic cancer therapy like IV vitamin C. And spiritual and emotional healing is very important. So many patients is so hopeless, and we can give them hope and also pray with them. Okay, and that's my last message. Okay, all cancers are sensitive to vitamin C, artesunate, B17, DCA, B15, and then high dose selenium, immunocotel, fever induction, hyperthermia. These are the very useful modality for all types of tumor, no matter what. Okay, some people say I don't do lymphoma, leukemia. Come on. The principle works the same, and you can do that. Okay, don't forget to catch the cancer stem cell. For every cancer, there is a driver of the disease called the cancer stem cell, the embryonic level. The highest level is the embryonic level. Draw the blood, send to the lab that I use is actually from Greece. I've been to this Greece lab before, and then me and Kelly was there, and then I think some of them also from Philippines, we were there. We met a lot of good people there, and then this is the embryonic cancer cell lab. So we need to hit the iron until it's hot, okay? For we are God's workmanship, created in Christ Jesus to do good work. I think in cancer is a good work that we are able to help the cancer patient. And God has prepared this in advance for us to do and walk in it, okay? So hit the iron until it's hot, and thank God that I met so many of them. I met this, Dr. Nabis from Nabisol there. This is from Yesan, then Amirang, and then this Chihu. I want you guys to understand that our journey will never be the same again. Since 2-3 years ago, we are using this machine, and then we want to declare cancer, we're done with you. And we will never give up until we see 5,000 doctors being trained into this, trained well and well trained into integrative oncology. And then every year will come. This is the last year, and then the International Viral Research Alliance. I think, Mr. Han will be able to explain more why it is called IVRA is very important for antiviral. Because of this virus, we know each other. Thank God for this virus, and the virus is probably good, and it's probably for us all together, meet up together. Okay, so see you next year, June. Okay, if there's any questions, you can get in touch with us, and I'll see you around. Thank you.
Very active participation, Ivra. Thank you.